Good afternoon. My name is Jihyunju. Thank you for joining me for this talk on pioneering Korean innovations, specifically CAR-T cell therapy for autoimmune disease, and also iPSC-based cartilage regeneration for osteoarthritis. I'm honored to share some of my latest research and clinical experience from Seoul St. Mary's Hospital. I'm a professor at Rheumatology Division of Seoul St. Mary's Hospital and a director of Catholic iPSC Research Center. This is a historical landscape of advanced therapeutics since synthetic chemicals began to be utilized in medications starting in the late 1800s. The first generation of revolutionary biodrug consists of proteins such as insulin and vaccine. These were powerful and akin to gun. The second generation saw advent of monoclonal antibodies. These drugs are even more potent and precise, comparable to targeting lipase. The third generation, as you are aware, was CAR-T therapy. This represents the pinnacle of power and accuracy in drug therapy, much like a guided missile. I envision the next generation of drug will differ significantly. I believe the focus will shift toward healing with recovery and regeneration, emerging as a key player. As 2025 January Nature Journal feature predict that stem cells will soon become a routine for conditions like cancer, diabetes, and Parkinson's disease, we may underscore the shift toward regenerative and cellular therapy. This is the very interesting slide. Last night I made this slide, and as you can see here that the iPSC therapeutics, the Japan's effort for the R&D money is very high, especially focusing on the Shinya Yamanaka's the R&D funding consists of 1/3 of Japanese R&D money. It's very big, maybe 100 times than Korean R&D money for iPSC therapeutics. That's why I show you this slide. I know very well about Japan's bet, and that they bet on Shinya Yamanaka with billions of dollars for 10 years since he won Nobel Prize in 2012. I remember Shinya's professors looked very young and energetic when he won Nobel Prize in 2012. However, we met again in Keystone Symposium 6 years later. He looked tired and carrying very heavy load, and I know that he had to work very hard to apply iPSC technique in Japan. I believe so. Again, Nature in 2025 April last month, at news features section, they published articles about Japan's big bet on stem cell therapy might soon pay off with medical breakthrough. However, last month's editorial, 3 outstanding Japanese scientists were introduced. Left first scientist, Professor Okano at Keio University, using iPSC-derived neuron, he showed 2 of 4 patients recovered among completely paralyzed spinal cord injury patients. Meet scientist Masayo Takahashi, she developed iPSC-derived retinal sheet and spheroid and very successful in restoring blinded macular degenerated patients. She now started a biotech company for commercialization of her products. Life scientist Jun Takahashi is the husband of Masayo, as you know. He is a director of Kyoto University. He showed very recently that transplantation of iPSC-derived dopaminergic neuron improved symptoms of Parkinson's disease in 4 among 6 patients. He is a husband of Masayo and had as you can see, a samurai statue in his office. I've known well these 3 scientists for a long time and a friend of them. And at the Nature News, I'm very happy but a little bit jealous about their long-term effort and tremendous achievement. I will give my talk in order of background and chronic degenerative challenge in aging society and recent updates, iPSC derivatives for cartilage repair, followed by CAR-T cell therapy for autoimmune disease. Finally, perspective and conclusion. Let's begin with how degenerative disease are impacting both joint and nervous system in aging society. The humans are larger brains susceptible to degenerative challenges, disease like Alzheimer's, and heavily used the knees by standing evolution susceptible to osteoarthritis. Osteoarthritis is a physical disease, which Alzheimer's is a neuronal disease. Both demands the innovative treatments beyond conventional therapies. Our group is focusing novel therapeutics on these two topics using induced pluripotent stem cell. In South Korea, we have 3 types of stem cell available. ESC, embryonic stem cell, is totally prohibited in my Catholic universities because these cells could be cultured after destroying human fertilized blastocyst. Maybe you know that it's a religious reason. MSC is former main player in our institute, which cells can be gathered from adult like you at fat, bone marrow, and cord blood. However, these cells is believed to be inferior due to less potent and less limited expansion. But iPSC, similarly potent to ESC, could be easily generated by transduction of Yamanaka factors to human cells, becoming a potent candidate source for future cell therapy, I believe, a good alternative to ESC. We mainly use cells as source for cell therapeutics, but we also can use cell derivatives such as small molecules of secretome or exosome, and extracellular matrix, and an organoid or pellet or spheroid. Listen updates of various forms of iPSC derivatives for chronic degenerative disease. From induced pluripotent stem cell, we can generate various kinds of iPSC derivatives for cellular and non-cellular therapeutics. Cellular derivatives include human primary cells, iPSC-derived cells, and 3-structure spheroid. Non-cellular derivatives consist of extracellular matrix and mitochondria and cell-derived particles such as exosome and secretome. First candidate is non-cellular 1 extracellular matrix. It is well known that chondrocytes produce extracellular matrix and communicate with the ECM very closely. ECM also possibly affect chondrocyte biology. We would like to know how much ECM could help chondrocyte and be potential candidate for therapeutics. We made cartilage from iPS cell, and then we eradicate the live cell and retain the cellulite ECM. Chondrocyte can easily be differentiated from iPS cell. They are expressing chondrocyte markers at the level similar to that of primary chondrocyte. ECM was obtained from iPS cell-derived chondrocyte, which contain essential ECM elements such as fibronectin and type 1 collagen and type 2 collagen. When we introduce this extracted ECM into chondrocyte differentiated plate, stem cell differentiate into chondrocyte more efficiently. In vivo transplantation of the ECM into cartilage defect area revealed more efficient recovery and regeneration of cartilage. It was published November in 2023 in some biomedical journal by my PhD student, Xiao Che. At South Korean clinics, we now already use several types of ECM, hyaluronic acid, and a type of therapeutics for injection. More recently, human dead body-derived cartilage ECM, megacartic, is commercially available for surgical implementation in South Korean orthopedic clinic and an operation room. Second candidate of non-cellular derivatives is mitochondria. It has been known that defective mitochondria may contribute to osteoarthritis pathogenesis. Theoretically, younger and healthier mitochondria can be collected from iPS cell. We have a very nice and professional colleague at Payan Biotechnology. In collaboration with this company, we could separate well-characterized, high-quality mitochondria from iPS cell. When we introduce mitochondria derived from young iPS cell into joint of rat, with chemically induced osteoarthritis. We observe an interesting result. In cartilage surface show recovery and like this. Histological analysis has been conducted. Mitochondrial injection have the potential for cartilage protection. A lower dose of mitochondria showed better efficacy. However, higher dose was less effective, which may be due to, we think, that toxicity. As of now, we are not certain. In vitro study with wound healing assay, mitochondria facilitate cellular activation and migration. When mitochondria are treated with human primary osteoarthritic chondrocyte, COL2A1 and SIRT1 gene expression increases, and glycosamine glycocan GAC contents production also increase. Similar result could be observed in vitro experiment using cartilage pellet. Interestingly, mitochondria derived from mesenchymal stem cell did not have the cartilage protective effect. Only iPS cell-derived mitochondria may have this potential. Till now, there are no curative therapy for chronic degenerative disease such as Alzheimer's or osteoarthritis. From the viewpoint of energy supply, healthy and young mitochondria transplantation could be one candidate for future therapy, I think. Our colleague Eun-Young Lee, maybe you know that, rheumatologist in Seoul National University, with a collaboration with Payan Biotechnology, I also work with, together developed mitochondrial therapeutics, and it is under phase 2 clinical trial in South Korea, and the world first mitochondrial clinical trial for the myositis. And this target is our rheumatology disease, the idiopathic inflammatory myopathy. The third candidate for non-cellular therapeutics is cell-derived particles such as exosome and secretome. We have several experiences about secretomes and exosome. Exosome should be separated using chromatography or ultracentrifugation, which require rigorous energy and cost. However, secretome can be simply produced by freezing and drying culture sponatant. Culture sponatant are commonly discarded as a waste after media changes. The secretome strategy use this waste, thus recycling it. Our experience is not with osteoarthritis, but with Alzheimer's disease or symbolic neurodegenerative disease. We have chosen the intranasal delivery route, which is easily accessible and typically without complication. The close proximity between the nasal cavity and the brain base makes this route as a potentially effective method for delivery. Neurotropic secretome can be produced from the culture media of iPSC differentiated cortical neuron cells. We collected this secretome and treated progenitor neuron cells with it. It promoted nerve differentiation in a dose-dependent manner. Immunofluorescence study revealed active sprouting of neurites from neurons. Intranasal delivery of secretome derived from cortical neurons have been shown to recover abnormal behavior associated with Alzheimer's disease. This is a wheel test frequently used for testing pathological behavior associated with Alzheimer's disease. Interestingly, the secretome derived from mesenchymal stem cell thus didn't improve behaviors related to Alzheimer's disease. However, secretome derived from induced pluripotent stem cell cortical neurons have shown a neuroprotective effect. CNS secretome decreased Alzheimer's pathological proteins such as amyloid beta and phospho-tau protein in those mouse brain. An immune fluorescence study revealed that normal mice have few green spots of amyloid beta protein. As this progressed, many green spots of amyloid beta protein accumulated. However, CNS secretome treated mice, the green spots disappeared, indicating the secretome's potential for preventing or clearance of amyloid beta pathological proteins. It was published November in 2023 by my PhD student Mo Hyun-kyung, who did this job very well. She is now at Mayo Clinic in USA. Dr. Mo was introduced by Professor Eun-young Lee in this hospital. I'm grateful to her for this introduction. South Korean exogen company Brexogen performs clinical trial on atopic dermatitis in USA, and also Korean company Ilias Biologics for acute kid injury model in Australia. This is the first candidate for cellular therapeutics is the primary cell, which could be used for osteoarthritis treatment. We conducted a clinical trial, study using human primary bone marrow-derived MSC for intra-articular injection in patients with knee osteoarthritis. Participants were randomly assigned to two groups, a control group and an MSC injection group. We followed up with this patient using X-ray, MRI, and various patient-reported outcome over 12 months. Now we are following up 36 months and for 3 years. This is photo of the first intra-articular BMMS injection. It was one of the most unforgettable and fascinating moments in my life because I could do by myself in clinical study using the cells. It's first experience of my time. And with the help of Professor Jo Seok-gu, we could perform this clinical study. We would like to give my sincere gratitude. This is a photo of first sono-guided injection in a patient. The baseline characteristics are similar, and we expected much, but we could just see that at 9-month visit, there were small, statistically significant, but limited improvement in WOMAC pain and Kuh's pain score. Disappointingly, there was no difference in MRI scores, structural changes about bone marrow lesions and bone marrow edema. With assistance with MRI specialist Professor Junyoung Jung, it was discovered that MRI T2 mapping is useful early marker for cartilage degeneration and regeneration. It means that qualitative changes, as reported in recent journal. This technique was applied to verify whether MSC could influence the degenerative changes in human cartilage. Very interestingly, it's the only positive result we could get from this my first clinical trial. Interestingly, serial follow-up of T2 mapping in MRI 12 months showed significant improvement, indicating that cartilage degeneration was ameliorated by MSC treatment. It's only positive finding I could get. It was interesting to find that longitudinal analysis of T2 values differ between medial and lateral compartment of knee. As observed in the medial compartment, MSC group consistently slow down degenerative changes in comparison with the lateral compartment. We could not observe this same result in the lateral compartment. As you know that medial compartment is a very important area in osteoarthritis progression. It was published in January this year by Dr. Bong-woo Lee, who did this job very well. Similar to my clinical study using MSC, Korean stem cell companies have a long history of development of stem cell therapeutics. Korean FDA gave pioneering approval for 4 MSC therapies in early 2010. And however, they did not approve any stem cell therapies more since 2017. Korean FDA and Stem Cell Society realized that lack of evidence and minimal efficacy of these commercialized cell therapies. Only one stem cell therapeutics of CAR-T-stem, which is gathered from cord blood, survives till now. And neuronatal R was another promising one, which was bone marrow-derived MSC for treating Lou Gehrig disease, ALS. Despite its long developmental history, maybe 8 months ago, it revealed to be failed at phase 3 clinical trial in USA. It resulted in that, as you can see, that the stock crashed to the down. It's so disappointing result that I came across interesting information sign in Osaka airport in the internet, and the sign indicate the dead end ahead, as you might expect it when road terminates. However, it seems that the Japanese officer relies on the Google Translate by mistake, and the raw translation was as follows. I think that the future simple MSc cell therapy could be like this, and this dismal future of simple MSc appears to be a metaphoric expression, I think. However, very recently, we heard that US MSc therapy first ever FDA approval last December. You could see a very steep increase in stock price of Mesoblast at the end of last year. And Mesoblast developed MSc therapy for GVHD named Lion's. This is the first and last approval of US FDA approval. The fifth candidate for cellular therapy is engineered cell derived from induced pluripotent stem cell, or MSC. You know that irreversible spinal cord damage could happen. iPS cell could be differentiated into motor neuron, which could be transplanted into the lesion. We could generate human iPS cell-derived motor neuron progenitor cells and mature motor neuron generation. Chronic spinal cord injury could not get recovery due to inflammation followed by space-occupying fibrosis and glial scar. We could generate spinal cord injury model with Marxist impactor experiment. We performed 3 sets of study: single motor neuron transplantation for simple regenerative therapy, multiple mesenchymal stem cell transfusion for simple anti-inflammatory therapy. Third, preemptive multiple MSC and single motor neuron transplantation for anti-inflammatory and regenerative therapy. Simple motor neuron transplantation is minimally neuronal recovery. Multiple infusion of MSC showed more effective but not satisfactory. Stepwise cell therapy with multiple MSC infusion followed by motor neuron transplantation promoted behavioral improvement in this severely spinal cord injury model. This is schematic graphic abstract of our experiment of stepwise combinational stem cell therapy. It was published last year back-to-back journal at the stem cell by PhD student Jang-hoon Kim, who did this job very well. Engineering stem cell is also one of more promising cell therapy than simple MSC therapy. Korean stem cell company Tissue Gene C developed combination cell therapy using chondrocyte and TGF-beta transduced chondrocyte together. They are awaiting US FDA's new drug approval in near future. They are expecting, not all scientists agree with that, but they are expecting the US FDA's new drug approval. And this company had very huge scandal that transducer cell was contaminated with 2970 cells. So it was rebuked in Korean market and is still undergoing a lawsuit between company and Korean government till now. Maybe all of you know that transplantation therapy using iPSC differentiated dopamine neuron in US and Kim Kwang-soo, Harvard University, and Japan, as I told you, Jun Takashi. In Korea, they also showing the positive result in series of clinical trial. Dong-wook Kim, and Korean company SD Biomedics, showed that they also, always I met them, they told me that good clinical result is coming out. Please expect good result. They told me that. Also, Chinese group developed transplantation therapy using iPS cell differentiate beta cell for diabetes cure. Shanghai group showed insulin-free condition for a long time in severe type 2 DM patient. This is finally, the 6 candidates of cellular therapeutics is spheroid and 3D structured therapeutics. This target is important, why I make a presentation in this conference. For improved cell therapy, have begun to consider changing material, the cell source. While MSC may be considered outdated like a 2G phone, and iPSL and ESC have emerged as a new cell source comparable to 5G phone. For better cell therapy, we began to think that we may have to change the formula. 2D pellet or spheroid are functionally superior. They survive more than 3 months and adhere well to cartilage defect. However, single cell have the advantage of injectability like Imbosa, which is practically superior. We decided to position our candidates in between. I think the truth may lie between two extremities, I think. Injectability means greater accessibility, ease of use, and the ability to persuade patient about this therapy is very important aspect of as a clinician like me. In Korea, we have 4,400 operating room, and additionally, there are more than 20,000 outpatient clinic office in Korea. This number represents more than just simple comparison of operating room and versus physician's office. And the material used in outpatient clinic can be lead to significant differences. This is summary slide for our strategy. We try to change the cell source. We try to change the formula. Also try to change the delivery route. In past, single cell formula for surgery was dominant. Recently, we have focused on 3D pellet composed of multiple cells and ECM matrix together. We are going further to develop into small spheroid and then small enough to pass through the needle. The first strategy involves a different cell. Second strategy focuses on spheroidal formula. And the third is an injectable formula. This figure may explain more than me and than 2 words. Like this. It's like some spheroid is very important concept. Injectable spheroid can be produced in GMP facility for 40 days. You can observe small particles spheroid in the culture disease. We validate our injectable spheroid in various animals from mouse, rat, rabbit, beagle, pig, even the 4 horses. This is very complicated and busy slide. However, for 4 years, we could get the permission from Korean FDA IND last August. 1st August, this is I cannot forget that the day I was called by the Korean FDA officer and you are approved. That at the time I already cried at the time because 4 years of the effort, it was really very challenging to me my life. And I was happy and honored to inform you that we will we injected our product this April, and we finished it. Yes, not 2 cases, 3 cases of intraarticular injection of chondrosporoid on osteoarthritis. I'm sorry for Korean language, and phase 1 equivalent clinical study with mucon. Mucon means that minimal injectable unit chondrosporoid. We called it not muchon and mucon. No side effect until now. Efficacy, it has a comfortable efficacy. It has some functional improvement and also some kind of the pain improvement we could observe. Yes, I will give my humble experience on CAR T-cell therapy for infected lupus because of Hyungjin Kang is master guy in South Korea, but I just have experience of just 1 patient. And this is experience of first CAR T-cell therapy in South Korea for not lymphoma or cancer, for refractory lupus and autoimmune disease. Maybe you know that very well that CAR T-cell therapy share the same target on CD19 B cells and B-cell lymphoma and lupus. We get Korean FDA approval for compassionate use of investigational drug on this patient in this spring. This CAR T therapy procedure and leukapheresis and lymphodepletion chemotherapy and CAR T-cell infusion and post-infusion monitoring. I was also sad and anxious when she had a side effect of acute renal failure, kidney injury after high dose of chemotherapy, and also cytokine releasing storm syndrome. However, she could overcome this adverse event. This is the infusion process of CAR T therapy in best-selling drug. Serial infusion process CAR T therapy unpacking and thawing, filling syringe and bolus infusion. This is very not familiar. This is very, I have never done chemotherapy or this kind of the processes, never. So it was very challenging and stressful condition to me. However, we could see that some kind of miracles and rapidly decreasing the anti-dsDNA antibody and proteinuria. This is a symbolic representative marker for lupus activity. Lab results show dramatic reduction and anti-dsDNA improvement complement level. Proteinuria disappear and renal function was stable. She does not take any immunosuppressant medication for 6 months. I think that she is cured now. She is a baked patisserie, and she makes some cake for me. And some kind of Korean newspaper issued our story. This final slide and perspective conclusion. Stem cell derivatives, extracellular matrix, and mitochondria, secretome, exosome are emerging source for therapeutics to managing chronic degenerative disease. From our experience, they produce derivatives, and these derivatives in turn affect cells, I think. Go back to beginning slide. Historical treatment evolves from small molecule drugs like aspirin to protein drug, and then monoclonal antibodies, and more recently, CAR-T cell therapy. Now, we are looking ahead at iPS cell therapy as a next generation modality of recovery and regeneration. Using my personal experience, I could introduce recent updated therapeutics till now. Thank you so much for your attention.